Okay, so let's get started. Today we're talking about a value pyramid for healthcare messaging. And joining me today is Ron Remy, CEO for Mobile Heartbeat. Ron brings over 20 years of technology management and leadership experience to Mobile Heartbeat. Previously, he was the president and CEO of Auspice Corporation, a developer of software for the broadband cable industry, which was acquired by Aris. Ron's previous leadership positions include Chief Operating Officer of Motive Media and Biomed 2020 Technologies. Ron began his career as a systems engineer for Sun Microsystems. He has an electrical engineering degree from Brown and an MBA from Harvard. I met Ron about 5 years ago over breakfast in Orlando at the HIMSS meeting. We discussed Mobile Heartbeat, and he showed me a nice demo on his iPhone. Um, Today, we're going to talk about a topic that Ron has um, developed that sort of gets into the value pyramid and how accounts mature in their adoption of messaging systems in healthcare. Um, so let me go ahead and pull up the pyramid itself, and we will I'll provide a brief introduction, and then Ron will describe the pyramid here. Alrighty. So there we are. Last January, Ron, you wrote a blog post on scaling the pyramid, where you present a framework for a value hierarchy and offer some insights into the evolution of the healthcare messaging and orchestration market. That value pyramid is the focus of our discussion today. Ron, I'll ask you to go ahead and explain your diagram, and we'll get into our discussion.
Text messages, you've got phone calls, you've got incoming alerts. And if you are successful, then you move up to the next rung of the pyramid, the value pyramid, and you hit adoption. And what we mean by adoption is the number of network points, aka users, that have adopted your CC&C platform, all of your products. And you measure that very, very diligently. You look to see what your monthly active users are, not just your logins, but how many people are using the product every month. You start measuring the number of events, and you start looking at key ratios like the number of text messages to phone calls. And you're looking for a number of metrics, making sure that your monthly active users is going up, your events are going up, and your text to call ratio is getting higher and higher. You want to have more text messages to fewer phone calls. If you're succeeding here, then you've hit the second rung of the value pyramid. You've hit broad adoption across the enterprise. Does that make sense to you, Tim?
It does.
All right, so now I've got broad scale adoption. I've got a lot of clinical and non-clinical users, basically network endpoints of our system. And now that I've got them in place, I can start looking at that information and start evaluating who is communicating with whom, who's calling one another, what roles are sending text messages. Tremendous learning that will come out of this measurement of the workflows of who's communicating with whom. You will be shocked at what is going on once this system is in place. Now you've got these workflows identified, you've got your key communication pathways identified, and you can start making improvements on them. And that's the next rung of the pyramid, the efficiency rung. And what you're looking at here is to adopt and implement as much lean thinking as you can possibly put in place in your facility. If you're familiar with lean process and lean thinking, this is where you really start to see some impact in your facility. You're looking to take time and cost out and improve quality. So efficiency metrics like, for instance, if you've got a metric of how quickly can you get a patient from the ED up into a med-surg bed, admitted into a med-surg unit. What time does it take you to write a discharge order to the actual time of discharge, and how can that be improved through better communications? That is where you get the efficiency rung success level. And that's where you see both cost coming out of the system and time coming out of the system of everything you do in your facility. And the top level of the pyramid, and this is not so simple to reach, this really does take a lot of thought and a lot of implementation skills is the improved patient outcomes. And some of the things we've seen here is improving the time from a stroke event to CT scan through improving the efficiency and the workflow of everyone that you need to get lined up, all the staff and equipment lined up to get that CT scan done. Another one we're starting to see is predictive analytics towards sepsis prevention, an early intervention message that is sent to the care team that is an efficient way of making sure that that patient gets some early intervention. So we work with all of our clients, and these aren't static rungs. They're always changing. You always have to be working on each level that you hit. So for instance, you've got this great platform in place, but you need to continue to make it better, increasing bandwidth, increasing coverage of your network in the facility, better utilization of the smartphone software through integrations. You've got to keep working at each level, but as you get up higher and higher in the pyramid, the more valuable your investment in the software and the smartphones becomes.
That sounds great. There's been a lot of discussion uh, in the marketplace around messaging that pertains to a value hierarchy, and it's interesting to see you're the first take really that I've seen uh, that has tried to sketch out a value hierarchy, and it makes a lot of sense. Um, so let's start off talking about uh, sort of the bottom layer of uh, the the pyramid, and that is, um, it seems that buyers are starting to transition from getting point solutions to enterprise type deployments. They're not just looking to facilitate communications between, say, nurses and physicians, or just physicians.
Right.
It's broader than that. Could you speak to that as to how that
Sure.
is evolving?
Sure. I mean, the first part of this is that the early stages of this market and this technology was purely around secure texting, HIPAA compliant secure texting. I've got a potential security flaw in my organization. I need to put some secure texting technology in place because I know my clinicians are texting one another. And that was the first problem that everybody set out to solve. They started to look at this at a bit broader manner by realizing that it's a lot of capital investment and time and energy to put a solution in place just for secure texting. So it better be doing something else. It better be a more comprehensive communication. And I use the word platform, but that really is what you're looking to do. You're looking to increase your ROI. Because think about what you have to do. That the communication product, I say it carries a lot of water. It's the first technology, the first software you put in place, and it carries with it all the smartphone costs. It carries with it your networking infrastructure upgrade. It carries with it your MDM software investment. There's a lot of capital investment and time that goes into the first level of putting in this CC&C product. And if it's just going to do secure texting, it's pretty tough to justify an ROI on that. So it's got to be broader. And I think the more sophisticated customers have realized early on that they needed a more comprehensive solution, and they were looking for not just a secure text product built by two people in a garage, but into a platform that can scale across the enterprise, both vertically as well as horizontally.
It seems that most purchases in hospitals, and this applies to messaging purchases as well as a lot of other things, are driven by immediate or short-term needs.
Right.
Boom, something happens. I've got a
Yep.
problem. I want to buy X to solve Y. Um, and with this broader focus, do you see buyers shifting to more thoughtful, longer-term uh, approach to making these kind of purchases?
Yes and no. There's still the compelling event that where it gets them going on making the purchase. I mean, it could be a safety event, it could be a HIPAA violation event, it could be a new tower that they're putting up. There's some compelling event to get them started. But once they begin to investigate what they're going to buy and what it can be used for and how broadly it can apply to their problem set inside the hospital, that's when the intelligent investigation happens. I was just telling you before we started the call, I just came from a facility where I spent an hour and a half talking about the future of communications and realized that this facility has no concept of a care team. They really aren't ready quite yet for a full-blown communication solution because they haven't done the basics down at that bottom level of the value hierarchy. And that leads me exactly back to where you're going with this is the more thinking they do about the platform and the different levels of that value hierarchy, the more likely their successful implementation will be. They're going to get real value if they think this through.
Hmm. Now, your pyramid is also indicative of system potential or capabilities. And it does seem that there's a definite sequence to being able to move up the pyramid. You
Yeah.
can't really skip steps. How well understood is this pyramid? Is this something that is
Mm.
really unique, that you've uh, sort of put a stake in the ground first, or is this something that's understood by a lot of people?
That's a good question. I think inherently everyone understands it. They just need to see it laid out as a logical set of steps. I think they understand the base level of the infrastructure needs, and I think they understand the top level, the patient outcomes. That's really the great holy grail they're trying to get to. But I don't think that they've understood the levels, the steps that you need to go from the bottom to the top, and the sequence that you need to do to put in place to get that. And that sequence requires both technology, which we provide, obviously, but it also requires some change management inside the facility and some analysis. And you got to put those together. The analysis and the change management are just as important as the technology if you want to reach that top rung.
Do you see customer aspirations tend to be at the bottom of the pyramid, or the top of the pyramid, or are they sort of all over uh,
Well, that depends
when
on who you
adopting?
talk to inside the facility. If you talk to the chief medical officer, the chief nursing
Mhm.
information officer, they go right to the top of the pyramid. If you talk to the director of IT, they're just trying to keep their infrastructure up and running. And they've got this new thing, this smartphone technology that now they've got to make work and keep it secure. They're down at the bottom. So we're there to bridge the gap. There's the clinical needs at the very top end and the IT needs at the bottom. And as a software company, we got to be able to speak to both of those and help them get up those rungs without causing conflict.
Mhm. Now, as you move up the pyramid, do you see additional system capabilities or certain sets of features that come into
Yeah.
play?
That's a really good question. So the base level set of features is the obvious ones of having great communications infrastructure itself in your product. And by that, I don't mean just text messages, but one of the biggest problems is successful voice. You've got to have absolutely rock solid voice. You cannot let phone calls drop. And that's been one of the challenges of our industry is some of the infrastructure requirements that you've got to fulfill. Now, when you go up to adoption, what that means is that you're talking the most people, the broadest set of users, not just in one hospital, but across the enterprise. And that hits on scalability. If you don't have a scalable product where you can scale it out to a large number of users, you're not going to hit that adoption number. And that adoption milestone, we refer to Metcalfe's law all the time. The value of your network is the square of the number of nodes. And if you think of your end users as nodes in a network, every end user that has access to your technology, you're adding exponential value to the entire network overall. So if you can't hit those adoption numbers, you're not going to get the value out of the network. And if you don't have enterprise level software that can scale not only vertically in your existing enterprise, but across still other hospitals you may acquire, you're going to be stuck at that level. You're not. Once you get beyond adoption and you start looking at efficiencies, now you've got analytics that you've got to bring in. You've got to have some data warehouse. You have to have people that can make sense out of it, both internally in your company as well as with your customers. And then when you get up to improving the workflows, that's change management. That's all about making people do things differently and encouraging them to do things differently. So it's not just technology, it's people skills and it's analytical skills. And it's tough to put them all together. It's really challenging, both for us as well as for our clients.
Is this a pyramid that every messaging and orchestration vendor will need to support in the future as the market matures?
I would think so. I can't imagine that our competitors in the market and the large scale hospitals that adopt this can go about it any other way. We've been doing this long enough and we know what it takes to succeed. We've got some incredibly successful clients that are working their way up this pyramid rather quickly, and they're doing it the right way. They're not trying to get to the top without getting the underpinnings underneath it in place. So I'm pretty sure, you're never 100% sure, but I'm pretty sure that that's what's going to be needed for every vendor in this space.
Messaging can have a dramatic impact on workflow automation and productivity, as the pyramid shows. It seems that workflow can be divided between optimizing person to person messaging and workflow that's orchestrated by systems integration and
Mm.
messages generated by the messaging system itself or information systems integrated with the messaging system. What kinds of insights can the organization gain by measuring and analyzing person to person messaging?
So that's the analytics underlying adoption. One of the things we always do with our clients is we take a period of time and we measure with them who is communicating with whom and what are the pathways. Phone calls, text messages, is using the page replacement feature, and we start looking at not only the raw number um, of these events, but how they change over time. And you will then find some fascinating person-to-person pathway um, insights. And one of the ones that always got me was how many communication events happen outside of nurses and doctors to the ancillary staff, to the
Mhm.
pharmacy, to the warehouseman, which is huge in a couple of our clients for getting supplies in place, to operation staff, bed cleaners. That is person to person communications that you just don't usually think about in our world. But once you start measuring and you've deployed broadly enough where these people have access to the network, it's shocking how important they are.
Yeah, care coordination is a huge aspect of caregivers' time. Is it possible to discern the actual workflow steps from analyzing this data, or does this analysis better inform the understanding of a particular workflow that has become known another way?
Ooh, that's a tough question. I think it helps you understand the baseline of what workflow is today, and that as your clinical informatics team puts a change in that workflow, enables you to measure the impact. I'm not so sure you, without some real clinical insight, you can just take the raw data and immediately see the changes you need to make. They'll give you some guidance, but you need to measure your baseline versus what happens after you make the change. So think of what we do as a tool to give you some clues and to enable you to tune the changes that you make to get them to optimize them. So it's not magic. The pathway, we don't define a magic pathway, but we do at least give you some clues, some guidance to follow.
Do you have some examples of customers applying this data in a lean process improvement kind of way to optimize workflows?
I have a couple favorites, and they've called their own services. They came up with use cases of our product that just kind of surprised us. Um, One they referred to as Snap Pharmacy is they looked at how many times the clinical staff was communicating with the pharmacy, and they were communicating with the pharmacy all the time. And then they did the next best thing. They asked the question, well, if you're communicating all the time, what are you communicating about? And it was questions about meds. So our product has the ability to quickly snap a photo and put it into the chat message. So they enabled a program they called Snap Pharmacy, where if you need to reach a pharmacist, and we've got the concept of you don't need to know this pharmacist's name, you can have a role for the pharmacist and just send a message to the role. They'll snap a photo of the med in question and snap it down to the pharmacist and get a response back.
Mm.
I mean, it's a workflow that was an obvious one once they got some sense that this was needed. The second one, which I love, is they found that they had a lot of communication going with the maintenance department. of somebody would see something around the facility, a light bulb out, a broken floor tile, and they'd need to do something about it. And they'd send a text message. They realized they're sending a lot of messages to maintenance. So again, utilizing the camera, they snap a photo of the light bulb out or the floor tile missing with a location, and they send it to the maintenance contact dynamic role, and they instantly kick off a work order. So what they've done is they've turned every member of the hospital staff into a member of the maintenance team. They've simplified the workflow of getting work orders generated.
Interesting. This is one of my pet peeves I've had for, gosh, 20 years, and that is everyone in healthcare wants to automate what they do, but nobody wants to change the way they do anything. And
Yeah.
it seems to me that not changing workflows when implementing a CCNC system results in, at best, no improvement in workflows and often a degrading of the workflow. And let me give you an example from the EMR world. Um, Before an EMR, the nurse goes in the patient room, goes to the medical device, looks at the readings on the medical device, writes them on her hand, goes to the central station, pulls the chart out, writes them down. Okay, that's fine. That's the workflow. Everybody's happy with that. You implement an EMR. The nurse goes into the room, goes up to the patient monitor, looks at the data on the monitor, writes down some numbers on her hand, goes to the central station still, goes to a computer, types in the number. Same workflow, right? So they wanted to automate, but they didn't want to change the way they did anything, and that's success. They didn't change anything, except that now that you have an EMR, that workflow is like unacceptable. There's a
Right.
huge resistance to that workflow, and it seems like there is a necessary amount of process reengineering even at the beginning of an implementation. And could you speak to that and sort of how you see the typical dawning of realization that in fact we don't really want to automate our existing workflows. We need to rethink some of those things so we can take advantage of the capabilities we're investing in.
Sure. The most obvious one that we run into all the time is facilities that have decided they're going to eliminate all their traditional pagers, the pagers that clinicians have been carrying around for the last 25 years. They still have hundreds, if not thousands of them out there, and they're paying pager services and rental fees. They want to take them away and they want to implement something different, but that change is a really tough one because those workflows have been in place for 15 years in many cases. So we work with clients, and this one is my favorite implementation suggestion from a client is, can you get rid, let's do this one step at a time. Let's get rid of the hardware pagers and have the pages go to the smartphone so that they can both send and receive. That will be step one. We'll save money by eliminating the hardware pagers, but we won't change the clinician's workflows quite yet because everything they've been doing the last 15 years requires those pager numbers and the pages to be sent. So it was very successful. They not only save money on getting rid of the hardware pagers, they've reduced what we call the utility belt syndrome of the clinician having to carry multiple devices on their belt. Now that they've got comfort with all the pages going into the smartphone, they can start eliminating some of the pager-based workflows one at a time. They don't have to do everything at once. So, change is scary. And your comment about, I really, I want to make a change, but I don't really want to make it. You gotta be flexible and you gotta help. The technology has to help, not create a barrier and make it harder.
That sounds like a great approach. Um, Does person-to-person messaging automatically gravitate to optimized processes and workflows, or is there a more formal process of creating use cases and doing observation and everything to really improve things?
That actually changes over time as the customer gets comfortable with the messaging system. When you first put one in, there is a lot of hey, okay, let's go to lunch. There's a lot of messaging going back and forth because it's new and it's exciting. And then you start looking over time how that changes. I was just at our oldest customer in Indiana last week, and they implemented our product back in 2012. And they have by far the highest ratio of text messages to phone calls of any one of our clients by a lot. And it's because of two things. One, their comfort with the product over time, but also their leadership really, really wanted this to change how they communicated. I was actually concerned that the phone calling aspect of what we do was failing. So they have a brand new CIO. I was there last week and I said, listen, I have to ask a question. I'm looking at the data and your text to phone call ratio is super high, much higher than the industry average and even much higher than all of our clients. Is there something wrong with the phone calling? And their answer was, no, works great. Every time, 100%. We just don't call much anymore. We don't need to. And then they sat for a second. They said, the best part about it is when we do need to make a call, the recipient knows it's important and will almost always pick it up. So it's very rare that that call goes to voicemail now because there are so few of them. Phone calls are interrupt driven. So you won't interrupt me unless it's really important. And they've been using messaging software for long enough to realize that that phone call from you is critical. I need to stop what I'm doing and take it right now. So there's a really interesting secondary benefit.
It's interesting how the characteristics of individual enterprises really play into their path to
Yes.
adoption. Now, the other day when we were talking about doing this, you had mentioned a experience with one of your customers using your system and how it facilitated things in a mass casualty situation that occurred
Right.
recently in Las Vegas. Could you tell us a
Right.
little bit about that? That was very interesting.
Sure. So one of our clients is Sunrise Medical Center, and it's a good-sized facility that is one block off the Strip in Las Vegas. We implemented our software floor to ceiling, very broad implementation last May, and they were very comfortable using it and became very facile with it. So on the night of the Route 51 Harvest Festival shooting event, 214 of the shooting victims were transported to this 50-bed ED. They came via Uber and Lyft. They came via police car. They came flagging down strangers on the Strip, driving them to the nearest hospital. So this particular facility was really faced with a challenge. Not only did it have a mass casualty event, but it had a huge number of patients showing up all at once. So the timing of this was critical. To top it off, it happened late in the evening at the end of the concert, and a lot of the hospital staff, you're in the third shift at that point, they're not there. So the stories of the heroics of the staff there are just beginning to be written and published about what happened. And what's really given us a lot of pride at Mobile Heartbeat is that we're featured prominently as the communication mechanism that enabled them to actually take care of these patients as efficiently and effectively as possible. The use of broadcast messages to mobilize the staff, both inside the hospital and those that were at home outside the hospital. The ability to both make phone calls and text messages instantly to groups as well as to roles where you may not know exactly who is a nurse at a floor or the cardiac surgeon, but they're in that role and you reach them instantly. And then one of the interesting infrastructure issues that popped up is that there were so many phone calls, cell phone calls, being taken and made in that area that the cell phone network failed in the immediate area of the Las Vegas Strip. And because inside the hospital, our product is using voice over IP to communicate, as long as the hospital Wi-Fi stayed live, all of the communication and networking capability stayed live. So it's quite a story. I would believe that we're extremely proud of being able to be a part of the success, even though that was a horrific event. We're tested and we've been through something that we know our product can stand up to that kind of stress across the enterprise.
What's interesting with increasing level of talk around 5G and how 5G is going to be so pervasive and have so much bandwidth, and just like they did with 4G and 3G, they talk about, oh, well, enterprises are going to want to replace their Wi-Fi networks with our cellular technology.
Yeah.
This is a perfect example of where maybe not.
Yeah.
That there are situations where the cellular network has inherent weaknesses. There's another topic that I see a lot coming up in hospital situations, and that is, well, and I think Spoke did some statistics on this, that well over half of hospitals have bought a messaging system, and most of those purchased one really just to provide secure texting to people that they knew were using cell phones to do texting that they shouldn't be doing. And typically in these situations, they were opportunistic purchases. So, for example, I talked to someone who has Imprivata for their single sign-on and access control, and they bought, Cortex because they knew the guys. Or I talked with the CMIO at Providence here in the Portland area, and he said they don't have any messaging for their physicians still, but that they plan to get the messaging product from Epic because they already have, they know those guys. They already have Epic. So now almost half of the hospitals, according to Spoke, are also looking to buy another messaging system because they're sort of moving up the value pyramid, or at least they're learning more and getting more sophisticated, and they're wondering about, capabilities and things they'd like to do that maybe their initial system can't do because they didn't ask that of it when they made the purchase decision. And so now we're dealing with this heterogeneous environment. And it all gets to the question of interoperability. And there's a lot of interoperability occurring already with staff scheduling apps and with alarm notification solutions. What's your view of this environment, and is this something that we need to move past? Is this something that's always going to exist and we need to deal with it? And how do we deal with it?
I guess I don't know if you would agree with me on this, but if you look at the history of healthcare IT, it sure seems to be a lot of silos and very little interoperability. I mean, I don't know if you'd give me the same. You're smiling, so I guess you agree with me on this, right?
Yes.
So if you look at mobility as a trend in healthcare, it has a very good chance of breaking down a lot of the boundaries and silos in healthcare IT. It has the opportunity to put the value back into the hands of the end user in a big way. And I'll give you two examples of that I think are really important. Is that and I'll speak about Mobile Heartbeat on this instead of the industry in general, but one of the things we've done that we're really proud of is the API set that we've built to enable third parties as well as the hospital itself to get access to the data that's inside of Mobile Heartbeat. It's unbelievably valuable data that as you move up that value hierarchy, you should analyze and build some value around by changing your workflows. But you've got to get the data out. You've got to connect to it. You've got to analyze it. So our API set is core to any client that is looking at making a long-term purchase around mobility. It really, really is unbelievably valuable. But the one I'm the most proud of, and my staff is going to laugh when I tell them this, is I believe that the history of healthcare IT is that any time you needed to modify a piece of software, you called the vendor up and it cost you $50,000 to $100,000. Oh, you want to change the look and feel of that? We can do that for you. It's a $50,000 change order, no problem. And what we've done with our product is we've enabled the ability to add third-party applications to Mobile Heartbeat at the hospital level. They do not require us to intervene. So they can actually add a third-party integration without calling us. And we've taken that one step forward. we actually allow them to modify the look and feel of Mobile Heartbeat, to add functions to it by calling other parts of Mobile Heartbeat and customizing its look and feel without having to call us. So we're putting the control of this system back into the hands of the hospital. And we're really adamant about that. We believe that that is where the future of both interoperability, but also breaking down these information silos, data silos, I guess you'd call them, is we want to be on the forefront of that. And we believe that mobility is got a chance. It's got a chance.
Well, the proprietary end-to-end solution has, for as long as I've been in the industry, been the default product strategy for medical device manufacturers as well as healthcare IT. And and it is problematic. One of my common slides in my connectivity work that I do is that proprietary connectivity is an oxymoron,
Mhm.
because the whole intent is to
Right.
allow the integration of third parties. And so if
Right.
you're going to have a protocol streaming out of your medical device, it could be a proprietary protocol, or it could be something like HL7. Which
Right.
one is going to make more sense? You know, have lower costs for both you and your partners, and probably higher reliability for your customers. Probably HL7. So, and increasingly, medical devices stream HL7 out of their serial ports and their network connections. Um,
Right.
there's two levels though. There's the systems integration level with other information systems that facilitates this coordination and workflow automation, which is critical, and it's an essential part of these kinds of systems. The other level though is the integration between messaging systems, and
Hmm.
um, typically, I mean, it doesn't make sense to have different messaging systems for the same people doing different workflows. Oh, well, let's do this workflow on
Right.
this system and do that workflow on the other system, because it gets confusing for the user. You could justify multiple messaging systems for different personas or users in your enterprise, and
Hmm.
not just in your enterprise, but within your healthcare community, and you know, the healthcare trading partners out and about that are outside of your enterprise that you need to communicate with on a regular basis. Um, so how do you see
Mm.
the interoperability between messaging systems? You know, we have interoperability between phone systems. You
Yep.
know, if you've got a Verizon phone and I'm on AT&T, I don't know that. I don't need to know that.
Yep. Yep. Well, I'll give you a better analogy with SMTP and email. You don't know, you don't care what your end user email system is. You just need to know the address to reach the end user. You send your message using whatever client you want, and it gets delivered there. And it started, I guess I'm old enough to remember the earliest days of email. It started with the simplest of text email messages. And then you started to add HTML messages. And then you added the ability for MIME attachments and for text attachments. And if you sent a message with a MIME attachment to another email user that didn't have a client that could read it, it it didn't break anything. You just couldn't read the attachment. So there was this magic interoperability that happened early on. And that is bound to happen in messaging as well. There has to be some standardization of how one message system communicates with another. And it all has to be centered around how you transport and how you know that a message was delivered at the other end. I mean, one of the challenges of disparate messaging systems is you have to make sure that if I send a message from my system to your system and you receive it, I know that. I know that you've both received it, the status of it, you've read it. So, call it a read receipt if you like. But I think that's a critical capability in any messaging system. Um, so it's going to happen. It's not going to be simple. I'm not sure which systems get on the bandwagon first, but I will tell you that the monolithic vendors that are building messaging systems are likely not going to be leading that charge, because that's not a capability that they want to see happen. They want every message, every piece of information flowing in their software. They don't want to see anybody else software in the hospital.
Well, you know, I think any vendor would prefer that. besides the monetary benefits of that, I would imagine that implementation and supporting the customer is simplified in those kind of scenarios. But I don't know that you can really dispute that at this point in time, we have a heterogeneous messaging
Right.
environment with both
Yep.
multiple client devices as well as multiple messaging vendors. Um, do you see the market eventually swinging to sort of a monolithic kind of solution, or do you see a long-term
No,
heterogeneous?
I see a heterogeneous solution, and it's going to be driven by the large clients and the thought leaders in the industry. They're going to drive the vendors, ourselves included, into making sure that we've got end-to-end connectivity with other messaging systems. I don't know if it's going to be a standards-based movement like SMTP is in email. It might just be, hey, here are the top 5 messaging systems in that we want to connect to, and you 5 figure it out, because we're not going to use any of you until you all 5 figure it out. Or we're not going to use you to your fullest capability, and we're going to pay you a lot less. I think that that's how this is going to happen. That's my guess.
Um, okay, that's it's interesting. There are some vendors that have very much a sort of monolithic approach that you may have multiple messaging systems now, but they don't meet all your needs. Our system meets
Yep.
all your needs, so you need to, if you're willing to replace those systems with our system, um, then we would love to work with you. If you're not,
Yep.
then there's other vendors out there for you to deal with. Um, and there are other vendors that are very much oriented, much like you've described, as it's a heterogeneous world. It's probably going to stay a heterogeneous world, and part of our strategy really is to exist in that heterogeneous world in an efficient and
Right.
effective way. Now we have a couple questions from the audience here. One is from William Hyman uh,
Hmm.
from Texas A&M University. I'm picturing users continuously messing with their phones rather than actually caring for patients. Um,
That's
uh,
a good point.
yeah, how do you see that really playing out in customer sites?
So a lot of our more sophisticated customers early on went to educate their patients around what these devices were going to be used for as they were admitted to the hospital. So they put up posters about, the devices themselves. The cases for the smartphones are labeled as medical devices, and they have a chat with a patient. I'm not playing a game on my smartphone. I'm actually taking better care of you. And some of the things they've done personally to get over this is the patient asks a question. A nurse standing with the patient says, "You know what? Let me ask your physician that question right now. Let me show you." And they put the smartphone screen in front of the patient, type in the question, and the response comes back. So there was a lot of concern amongst facilities that the patients would not see this tool, mobility and smartphone usage, as a positive. So the education and the communication with the patients was critical to this. And those facilities that have had the product and smartphones in place for a while, you get a lot of positive from the patients after they realize that this is used to better their care.
Well, and a lot of device management software allows you to limit the applications that get
Yep,
added to the device. So, they can't add solitaire and other
correct.
Facebook and other time wasters. Plus, many of the devices are shared enterprise devices, which makes it even more
Correct.
difficult to get everything set up with all your logins and all that stuff. Um,
Yep.
Another question here is some of your outcomes are interventions, not outcomes. Can you measure actual outcomes? And I assume what he means here are patient outcomes.
Yeah. Well, keep in mind that that is the highest rung on the value hierarchy, and very few organizations have made it up to that rung And if they have, they're just dabbling in it. I mean, the only real outcome that I know of that's measurable, that has been seen as a part of a better communication pathways, has been organizing a CT, stroke event to CT scan the process of organizing that. And I think I assume that's a better outcome of the faster time to CT scan is a better outcome. I can't imagine it isn't. But again, remember that getting all the way up that value hierarchy, that's the goal. And people are just starting their journey. Many of them are down at the bottom rung. Most of our even most sophisticated customers have just made it up to rung 3, and they're putting the plans and places in place to go all the way up to the top. So great question. Would love to be asked that question, 2 years from now and see how I answer it. I think I hopefully will have a really good answer in 2 years, but this is what we know today.
Have you seen any impact on length of stay and more timely discharges?
I have not. I've not seen that data myself. It doesn't mean that it doesn't exist. We're not privy to all of our clients' internal programs
Yeah.
and usage of the data, but that's a really good question. Those would be two fantastic outcome improvement areas that we hope and we believe that we could impact, and not just alone, but with change management and some thinking inside the facilities. That's a really good question, and not one I can give a really good answer to, unfortunately.
Let's swing back to the interoperability question. In many tech industries, manufacturers come together in an alliance or a multi-vendor type of framework
Yes.
that allows them to coordinate their certain technical aspects in an effort to, and this is almost always geared towards providing interoperability, actually.
Right.
Um, so that if you buy a thumb drive from one vendor and you plug it in a computer, and you buy a thumb drive from another vendor and stuck it in a computer, they both work. Um,
Right.
and they justify this collaboration around the fact that by having this minimal level of interoperability will grow the market quicker. Um, I guess this is sort of, I have two questions here. One question is, do you
Sure.
think if there was uh, that kind of plug and play interoperability between messaging vendors, would the market grow quicker?
I think so, but that's based on my history. Is that I was an early stage systems engineer at Sun Microsystems back in the 1980s through 1990, and Sun grew almost exponentially with that open architecture interoperability model. Open architecture at the operating system level using Unix, open architecture by adopting TCP/IP for networking and for networked file systems. So experience kind of guides your thinking going forward, and that's why I believe it to be true. One anecdote along that is a few years ago, I made some early introductory, we'll call them forays, to some of my fellow CEOs in the industry about building a standard around staff assignments, so that there could be a spec or something to follow for any hospital system that assigned a patient to a staff member to link them together to build the care team. And that fell on such deaf ears. No one was interested in building a standard for these staff assignment repositories. So, we built one on our own, and we're pretty proud of what we've done. But I think there's some real value if there is a standard for building the care team directory at some point. If third-party systems could follow the standard and know that the care team directory could be used by anyone else, by any other system, because it's standardized.
Mhm. Uh, the second part of my question uh, is, when you look at multi-vendor alliances for like USB or Wi-Fi or Bluetooth
Yep.
or a myriad of others, or Continua Health Alliance, really is a healthcare example. Do you see a potential uh, for something like that coming together in this industry? And I guess based on your previous answer,
Mm,
certainly that hasn't been the case um, as um, as certain market leaders start to emerge from the pack. I mean, I track 200 companies in
yeah.
this in this space,
Yep.
and they're not all doing equally well. So among the leaders, do you see the potential for a recognition of self-interest and coming together to address some of these issues?
I do, but I don't think it's going to be quick. And I know with my own experience of trying to drive it from a vendor standpoint, it fell on pretty deaf ears. So my guess is that it's going to be driven by the larger, more influential customers that are going to demand it at some level. And or it could be from the federal government putting a spec in place for a big deployment that absolutely has to have this. But this is not, healthcare IT is not an industry of interoperability and standardization. It has never been, and it's going to require some real change of leadership thinking for that to happen.
Yeah. All right. Well, we're out of questions. I'm out of questions. Thank you very much for joining us, Ron. I think we've covered some great information here. And to everybody that's watching, we'll be sending out a notice with a link to the recording, and I'll also include a URL to the blog post. Thank you, Ron.
Fantastic. It's a pleasure. Thank you very much, Tim.